Hello everyone. In the last video we have studied about the physical method of sterilization. So today we are going to discuss about the chemical method. Okay, chemical method means by using the different chemicals, maybe liquid form or gaseous form. So it is useful for the heat sensitive material like plastic and the lens instrument or endoscope. Okay, so mainly this chemical method you can use for the instrument which is heat sensitive, means if you are keeping in the heat it will melt. That type of articles or instruments you can use by chemical method. The first one is ethylene oxide chamber. Ethylene oxide alkylates DNA molecules and thereby inactivate the microorganisms. And ethylene oxide may cause explosion if used pure, so it is mixed with an inert gas. Example is neon. And it requires high humidity and used at the relative humidity 50 to 60%, and temperature will be 55 to 60 degree and exposure period will be 4 to 6 hours. The second chemical is activated alkaline glutaraldehyde 2%. So immerse item for the solution for about 20 minutes if organism is TB, that is tuberculosis, Mycobacterium tuberculosis. In case of spore, the immersion period is extended of 2 to 3 hours. Factor influencing activity of disinfectants. First one is if it is directly proportional to temperature, directly proportional to concentration up to a point, okay, like optimum concentration. After this level, no advantage in further increasing in concentration, time, range of action, and may be inactivated by dirt or protein or plastic. So these are the factors can influence the disinfection process. Next liquid is hypochlorite and glutaraldehyde chemical are more active against the hepatitis virus and then most of other disinfectants. So compared to other disinfectant, if you use the hypochlorite and glutaraldehyde, so it is more effective against the hepatitis virus. Next, another types is here phenol and phenolic. So phenol, like normally I think everyone have seen for cleaning out the floor you will be used as a disinfectant, phenol, okay, phenolic, and O-phenylphenol like Lysol, which contains in the Lysol also we have this O-phenylphenol, hexachlorophene and tree lotion. These are the all this liquid or gaseous things name, with that we can clean the surface objects, okay, to remove the microorganism. Next disinfectant is bigonides. It is a chlorhexidine. A member of the bigonide group is not a phenol, but its structure and application resemble hexachlorophenol, and it is frequently used for the surgical clean preparation and surgical hand scrub. So it is not a phenol, but the structure will be like chlorohexane. What happened? Surgical clean preparation means during any operation, no? Before shifting the patient to the OT, we have to do a skin preparation of that area, which area they are going to operate. So that area they can clean with these liquids. Okay. Next one is halogens. In that first one is iodine is effective against all kind of bacteria, many endospores, fungi, and some viruses. And its mechanism of activity may be its combination with the amino acid triazine in enzyme and cellular proteins. And iodophorone is a combination of iodine and an organic molecule, and iodophores do not stain and are the less irritating than the iodine. Okay, example is betadine solution or iodine solution. Next one is chlorine is used as a gas or a combination with other chemicals. So this chlorine gas is used for the disinfecting the municipal water supplies, swimming pool, and the sewage. Maybe you have heard that in the swimming pool, no, like any park, okay, any amusement park, they'll use the chlorine water, okay, to clean or to make the water disinfected, or any pipeline, that municipal water supply pipe. The next one is chloramine. It consists of a chlorine and ammonia. They are more stable than most chlorine, and they as military uses. US military uses this tablet for field disinfection of water in the field, like if it is in the ground, for that type of water they'll use this. Next one is chlorine dioxide in gaseous form is used for the area disinfection, most notably to kill endospore of anthrax bacteria. The next one is alcohols. I think everyone know in our hand sanitizer, no, there is a certain amount of alcohol. So it is also one disinfectant. Both ethanol and isopropanol, rubbing alcohol, are the widely used, normally at a concentration of about 70%. So if you use the hand sanitizer, maybe you have noticed it's not like fully alcohol, like 60%, 50%, 70%. Okay, and concentration of 60 to 95% are effective. They are bactericidal and fungicidal, means they can kill bacteria as well as fungi, but are not effective against the endospore or non-envelope viruses. And alcohol enhance the effectiveness of other chemical agent. So with any other chemical agent, if they're using the alcohol, it will be more effective. The next one is heavy metals and their compounds. Tiny amount of heavy metals, example like silver and copper, are effective antimicrobials. A silver coin on an inoculated nutrients medium will inhibit the growth for some distance. 1% of silver nitrate solution has been used to prevent the gonorrheal ophthalmia neonatum, which is infant might have contracted if they pass through the birth canal. Silver sulfadiazine is used in wound dressing. Wound means any cut, any injury. And it is available as a topical cream for use as a balm. Topical means what we are applying on the skin, outside. Okay. Then mercury chloride is a highly bactericidal but is toxic and corrosive and is inactivated by the organic matter. Organic mercury compounds such as mercurochrome are the less irritating and less toxic than the inorganic mercury. The copper sulfate is often used to destroy the green algae in reservoir or other water. You have seen, no, if you keep water for a long time, there will be one green color, greenish will be there in the wall. Okay, so for that we can use the copper sulfate. For the burning area we can use silver sulfadiazine. Okay, zinc chloride is used in the mouthwash and zinc oxide is used in the paint as a antifungal. So there are different types of chemicals are available which I can use as a disinfection, okay, for removing the microorganism from the object or from any surface. Okay, with this we have completed all the chemical method of sterilization and disinfection. So next we are going to see about the chemotherapy and antibiotic. So there are some terms. First one is chemotherapy. What is chemotherapy? Maybe you have heard about this word, maybe not. Okay, it is mainly for the cancer patient you will use this chemotherapy. The treatment of a disease with a chemical substance. So chemotherapy means it is a treatment procedure or it is a therapy which is used for the cancer patient with the help of chemical substances. Chemotherapeutic agent. The chemical substance used for the chemotherapy, these all are chemotherapeutic agents. That is example is cisplatin. Means whatever chemical substance you are using for the chemotherapy, these all are called as chemotherapeutic agent. Next one is antibiotic. A special kind of chemotherapeutic agent usually obtained from the living organism. So as you everyone know that antibiotic means it is used for the bacterial disease, yes, to kill the bacteria. Characteristics of a chemotherapeutic agent. It will destroy or prevent the activity of a parasite without injuring the cell of the host or with minor injury to its cell. Means if you given to chemotherapeutic agent to someone, it will destroy the cell, it will destroy or prevent the activity of parasite, okay, means microorganism, without injuring the good cell to the host, means for which body you are giving. Sometimes for host cell also it will give injury, but it is very minor amount. Be able to come in contact with the parasite by penetrating the cell and the tissue of the host in effective concentration. Leave unrelated, unnaturated the host natural defense mechanism, and such as phagocytosis and the production of antibiotic. Characteristics of antibiotics. It should have the ability to destroy or inhibit many different species pathogenic microorganism, that is broad spectrum antibiotic. And it should prevent the ready development of resistant form of the parasite. And it should not produce the undesirable side effect in the host, and it should not eliminate the normal microbial flora of the host. Means These antibiotics should act only against the harmful this parasite in our body. It should not affect against the normal flora which is needed for body, or it should not produce any type of side effect. So these are the characteristics of antibiotic and chemotherapeutic agents. So with this we have completed this topic. Thank you everyone.